Today, I'm announcing an executive order that requires everyone 5 years of age or older to wear a face covering in all indoor public spaces, regardless of whether they have been vaccinated or not. This is in effect on Friday, August the 13th, and it will be enforced. We'll enforce this mandate like we do our tobacco regulations. The process will be complaint-driven and will involve a series of escalating steps from education on up to a $1,000 fine. And we'll be sharing more of that process later this week for the public to report issues either online or over the phone. Why are we taking this difficult step now? It's because we know that masks work. They are tried and true, they are affordable, and they're an effective way to limit the spread of this virus and its variants. And until enough of us are vaccinated all across Multnomah County, masks remain one of the best strategies that we have to keep each other as safe as possible. This executive order builds off Multnomah County Public Health's late July recommendation, which we made as we began to see a resurgence of COVID-19 cases fueled by more social activities and most notably by the Delta variant, which we know is much more transmissible. The variant has undeniably changed the terms of our engagement with this pandemic. This executive order represents an urgent, necessary pivot in what we can and must do as a community to slow the spread and save lives while we continue to get our community vaccinated. We've heard from many members of our community who have expressed support for the clarity, gravity, and the enforcement of a mandate. Today's action brings consistency to expectations and minimizes confusion in the public indoor spaces across our county. But more importantly, it is a measure that we must take to protect each other, all of us, from a variant that is ripping through communities. It's a step we have to take to keep our kids safe, especially those who are too young to be vaccinated, as well as their teachers, as we get ready to send children back into classrooms next month. It's about keeping community members who remain vulnerable, including those who have not yet been vaccinated, protected as much as possible from severe illness that requires hospitalization, and in the process, making sure that our hospitals have the capacity to help people experiencing other life-threatening circumstances. It's about protecting frontline workers, our family members, neighbors, and friends who perform work that is essential to keeping our community moving. We know that the widespread use of face coverings can and does work to bring cases down. But I want to be clear, the best, most effective step that people can take to protect themselves and to protect each other is to get fully vaccinated. The vaccine is safe and it works as it should. It prevents severe illness, hospitalizations, and death. We are at a critical juncture in a pandemic shaped by community-altering moments. We have the tools, vaccines and masks, and we have the science to fight back against the surge. So it's up to all of us to lean in again and even further into our sense of connection and our concern for each other.
I'll just offer some brief remarks specifically about the Delta variant and just to be very clear on where we find ourselves today. So this is a version of the COVID-19 virus that emerged earlier elsewhere on the globe and has made its way to Oregon as we expected it would. It was expected to be the dominant strain locally by August, and that has in fact turned out to be true. It is more contagious, up to 3 times more contagious, and there's some early evidence that it may cause more severe disease. And unfortunately, some of that disease is manifesting in younger people who have yet to be vaccinated. I want to be really clear that the vaccine is outstanding. It has a tremendous safety record. It does its job in preventing severe disease and hospitalization, but we're learning that in the setting of the Delta variant, it will not prevent all infections. So a vaccinated person may still get a mild infection and therefore may still be contagious, which is why we're asking everyone now to wear a mask indoors in order to slow the spread. We're hoping to slow the steep curve that we're on, a curve that was at about 100 cases in Multnomah County in mid-July and is approaching 1,000 cases a week. I should say 100 cases per week in mid-July and approaching 1,000 cases per week as of early August. That's an order of magnitude. We want to be entering the fall, the respiratory season, the school year in better shape than we're in now with respect to our hospitals, families' confidence in returning their kids to schools, and keeping our businesses on the roads to recovery. I want to be clear that we are not trying to prevent every case of COVID-19. That's not possible. It's not realistic. We need to slow the spread with the tools we have, which right now are vaccine and masks. And I want to thank again the partners who are here today and hear more from our health systems by turning it over to Dr. Renee Edwards.